Everyone. So for my project, I decided to do the Shiba Inu as my breed. And one of the reasons that I kind of chose this breed was just because I have seen them, Shibas, all over the internet. And I never really knew about them until I started seeing them online. So this GIF is kind of an example of something I've seen online, and I just think that they are hilarious. So that's kind of why I chose them. So here's a few more pictures. There's a funny meme here, and I found this little comparison table. So you can have a white Shiba, a traditional golden Shiba, or a black one. So some history. Um, so Shibas, obviously, they're from Japan, and they are the smallest of their 6 dog breeds. The Akita would be considered the largest, and there are about 4 in between that are considered medium sized, and then the Shiba is the smallest. They were around for centuries. They were used for hunting and sport. Something else I found out, they actually they went endangered after World War II in Japan. And once that kind of happened, the ones that were left, they eventually brought a few of them over to the US, and that's when they started to breed them, and they became like popular over here. So yeah, they're pretty easy to train if you train them very young. And they have a really high-spirited personality. They also are kind of cat-like, agility-wise. They have a very funny bark, and yeah, they're just crazy. They can scream too. All right, so some of the health problems that I chose to do, we're going to be talking about atopic dermatitis that affects them and their skin, patellar luxation, which affects skeletal, their kneecaps, and progressive retinal atrophy, which affects the retina in their eyes. Atopic dermatitis, it's really common in a lot of dogs. Shibas can also get this. It's basically just a condition from, it is caused by allergens in the environment. And when your dog like inhales them or comes in contact with them, they can get very itchy, irritating reactions on their skin. And from scratching so badly, they can also get secondary skin infections. So their signs include redness, scratching, hair loss, scabs and bleeding, odor, and crusts on the skin. But also it tends to be seasonal, so it can come and go each year. And you can get treatment from your vet. It would include topical treatments, antihistamines, steroids, and you could use medical shampoos. And if it is really bad, in some cases your vet may even, if they're treating your dog for this, they will put a cone on their neck to prevent them from, licking or scratching the area, making it worse, basically. So here's some more examples. So this kind of picture with the dog just kind of shows the affected areas that atopic dermatitis can affect. And the bottom picture I actually found, it was pretty interesting. So this bottom picture, they did a skin scrape on a Shiba that had atopic dermatitis. And this picture is just kind of showing the cells from the skin scrape. So I thought that was pretty cool. Patellar luxation. So patellar luxation, also known as kneecap dislocation, it's caused by the patella, the knee joint. It slides in and out of place and it causes pain. So it's like a congenital malformation, or it can happen after trauma. And clinical signs, usually can see them around a few months of age with dogs. And really, it can be diagnosed by x-rays of the knee, and the most effective way to correct it is surgery and follow-up treatments, and making sure that you're getting your dog walking lightly with, light exercise. You don't want them to run or do anything too playful, too harsh. But it's also important for owners to know that since it is congenital, there's a possibility of it coming back. But I believe that percentage is only, I think, about 40 or 50%. And there's some more pictures here. So up on the left, this picture shows basically the different grades. So there could basically the severeness of the luxation. So you could have a grade 1 where it's not too serious, and grade 2 where you can see it's starting to go way more towards the left, and grade 3 it's almost looking as if it's behind the kneecap completely, and grade 5 kind of the same thing, but just different severity. This one on the right is an x-ray of an x-ray of before they did surgery on the left, and on the right after they did surgery to correct it. All right, so progressive retinal atrophy, or PRA. So this is an inherited disease in dogs. It affects their eyes. So it basically causes the rods in the retina to die. And since the rods they really help in night vision and things, one of the first signs is noticing that your dog may be fine, walking around and seeing in normal light, but if you're out in the dark or it's starting to get real dim outside, it may seem as if your dog has issues like running around or just looking. So you can also notice a glow in the eyes or some shine, and it often takes a while for this to be diagnosed, because a lot of vets, it's just hard to diagnose. It's hard to figure out that it is PRA, because there's a bunch of other things that it could be. The symptoms are relatively the same with other eye diseases, so this one may take a while for your vet to diagnose it. And a lot of the times when it is finally diagnosed, it becomes diagnosed when it's already getting worse. So really, one of the only treatments you can kind of do to slow it down or just make your dog more comfortable is starting your dog on an antioxidant supplement. And it's not painful, but it can't be cured. So most dogs eventually go blind from this, but since they're dogs, they can adjust to it. So they can adjust to it as long as their environment remains the same. If you have an old dog and they have this, I don't think it would be a great idea to, if you move to a new home, Because if your dog's already in the blindness stage, it would be really even more difficult for them to find their way around things. I don't have a Shiba, but I have a really, really, really old Chihuahua that lives up with my dad. He was my dog when I was younger, but since I moved to Cincinnati for school, my dad, it's just kind of my dad's dog now. But I'm pretty sure he has this. He can't see. He is completely blind. His eyes look just like this, and he is doing okay though. He's lived in the same environment forever, so he knows his surroundings, so he does fine. But I definitely think he has this. And here's some more pictures. So I did find a picture of a Shiba with this condition, finally. And then this one on the left just kind of shows the blood vessels in the eye. You can tell that they're getting very, very thin, which is one of the signs of the disease. So here are my sources. I wasn't sure how exactly she wanted them, but I guess for now I just put them as links. But I hope you guys liked my presentation. Thank you.